Susie is a 42-year-old female and has recently visited a genetic counselor after referral by her primary care physician. She has a family history of breast cancer on her father's side. She was found to not have the cancer-linked BRCA1 or 2 genetic mutations. The genetic counselor explained to her that A. She cannot develop breast cancer, but can develop ovarian or uterine cancer. B. She cannot develop uterine cancer, but can develop ovarian or breast cancer. C. She may still develop breast, ovarian, or uterine cancer. D. She may still develop breast cancer, but not ovarian or uterine cancer. E. She cannot develop breast, ovarian, or uterine cancer. The answer is C. She may still develop breast, ovarian, or uterine cancer. The incidence of cancer-linked genes can increase an individual's risk of developing cancer. However, their absence does not guarantee that the individual will not develop cancers of any kind. Alice is a 25-year-old female who is visiting her primary care physician for a routine physical. Which of the following may be conducted at the appointment? A. A rapid antigen detection test. B. A urine analysis. C. A vaginal ultrasound. D. A cervical cerclage. E. A Papa Nicolau test. The answer is E. A Papa Nicolau test. A Papa Nicolau test, Pap smear, may be performed routinely on adult women as a screening for cervical cancer. A rapid antigen detection test, rapid strep test, urine analysis, cervical cerclage, or vaginal ultrasound would not be part of routine screening. John is a 60-year-old man who has a first-degree relative recently diagnosed with cancer. He asks his nurse what he can do to prevent himself from developing cancer. Which of the following is incorrect? A. Eat a healthy diet. B. Drink 3 to 5 glasses of green tea with antioxidants daily. C. Wear sunscreen when exposed to the sun. D. Exercise at least 150 minutes weekly. E. Rest for 6 to 8 hours nightly. The answer is B. Drink 3 to 5 glasses of green tea with antioxidants daily. Green tea has not been proven to decrease the risk of developing cancer. All other precautions have been shown to decrease the risk of developing various cancers. Your patient is experiencing diarrhea after receiving chemotherapy. Which of the following is an appropriate nursing intervention? A. Instruct the patient to take Nclex daily. B. Encourage the patient not to eat until the diarrhea passes. C. Instruct the patient to eat a diet high in soluble fiber. D. Advocate for the patient to eat a high residue diet. E. Encourage the patient to remain as sedentary as possible. The answer is C. Instruct the patient to eat a diet high in soluble fiber. A diet high in soluble fiber will help to decrease the effects of diarrhea. Note that soluble fiber also provides relief from constipation. Nclex is a stool softener that will cause increased diarrhea. Remaining sedentary and not eating are not necessary and will not help a patient recovering from chemotherapy. A patient is suffering from alopecia secondary to chemotherapy. Which of the following is the correct course of action for the nurse? A. Avoid discussing the topic with the patient. B. Suggest dyeing the hair a lighter color. C. Change the bed sheets and towels frequently. D. Shampoo and brush frequently to reduce fallout. E. Use heat tools and products to maximize hair volume. The answer is C. Change the bed sheets and towels frequently. Hair loss can be alarming if large amounts of hair are seen in linens. Shampooing, brushing, heat tools, and hair dyes can increase fallout. The nurse should welcome healthy discussion about self-esteem if appropriate. Which of the following would raise suspicion for thrombocytopenia? A. The patient's blood seems to clot abnormally fast in response to injury. B. The patient is excessively hungry. C. The patient appears to have a slightly pink tint in skin color. D. The patient is experiencing an increase in depressive symptoms. E. You see small bruises that appear under the skin. The answer is E. You see small bruises that appear under the skin. Thrombocytopenia occurs when the blood does not have a high enough platelet count. Slow clotting blood, increased bruising, or petechiae can all point to thrombocytopenia. Anemia, a side effect of many chemotherapeutic agents, involves which of the following? A. The blood does not have enough healthy red blood cells. B. The blood does not have enough platelets. C. The blood does not have enough antibodies. D. The blood does not have enough healthy white blood cells. E. The blood does not have enough plasma. The answer is A. The blood does not have enough healthy red blood cells. Anemia is a condition caused by the deficiency of healthy red blood cells in the bloodstream. This results in lack of sufficient oxygen delivery to tissues. Which of the following is a consequence of a carcinogen? A. Carcinogens increase the plasma membrane's permeability to insulin. B. Carcinogens permeate the Golgi apparatus. C. Carcinogens bind to the cell's plasma membrane. D. Carcinogens alter a cell's DNA sequence. E. Carcinogens detoxify protective lysosomes. The answer is D. Carcinogens alter a cell's DNA sequence. Carcinogens cause cancer by making changes to the host's DNA. They can be chemical, X. Pharmaceutical drugs, or viral, X. Epstein-Barr. Additionally, exposure to radiation has also been known to damage DNA and is another form of a carcinogen. Ethel is an 80-year-old woman who is receiving chemotherapy for the treatment of a tumor. You are the nurse taking care of Ethel, while her chemotherapy is infusing dash. A. You ask your colleague to cover you while you go to lunch. B. You practice hourly rounding. C. You elevate the extremity of venous access. D. You call the physician frequently to update him on her response. E. You check the infusion site frequently. The answer is E. You check the infusion site frequently. Chemotherapeutic agents are often very irritating to the tissue if they unintentionally travel to areas outside the vein. They can cause severe tissue loss and degradation. Patients receiving chemotherapy need to be monitored closely for signs of infiltration. Nathan received chemotherapy 24 hours ago. You instruct Nathan to dash. A. Flush the toilet twice after going to the bathroom. B. Wear gloves when preparing foods. C. Clean soiled areas 3 or more times using bleach. D. Throw away soiled sheets for 48 hours. E. Only drink bottled water for 48 hours. The answer is A. Flush the toilet twice after going to the bathroom. People receiving chemotherapy should flush the toilet twice after use for at least 48 hours to avoid exposing anybody else to the byproducts of the chemotherapy drugs. Wearing gloves when preparing foods, throwing away linens, using excessive bleach, and drinking bottled water are not necessary and do not significantly reduce risk to others.